past 9 o'clock. Welcome back. It's a great day for this Wednesday. Smile, everybody. Dennis is here. How about that? Dr. Steffany Mohan is here because look at that smile. How about that?
It's cute.
Because it is time for a great smile. And we're going to talk about great smiles and how somebody can be proud of their great smile.
Yeah.
And of course, you're from the Plaza Dental Group. So what can we do to ensure a great smile?
Well, today we actually decided that we're going to talk about replacing teeth with dental implants. So if
as
people are missing
opposed
teeth, as opposed to other I mean, the great thing is we lose a tooth for any reason, and there's great alternatives. There's great ways to replace teeth. Dental implants are considered the gold standard. They're considered the best way to do it because it's like having your real tooth back. Instead of something that would come in and out, most people don't like their teeth to be removable. It's not their favorite
Maybe false
thing.
teeth then?
Yeah, false teeth, or even, you know, a false tooth or something to that. Well, I mean, imagine being in a social situation and, you know, you sneeze and your tooth comes flying out, you know? I mean, that's going to be...
They call those partials? Or?
Yeah, they call them partials.
Okay.
Yeah,
so are we discussing things like veneers today? Or
so dental implants can be all sorts of different things. It can replace, if somebody's missing one front tooth, it can replace one tooth. It can replace all of your teeth. So if somebody has a denture and the denture isn't secure, it's not tight, then we can, you know, tighten it with dental implants. It's basically like putting the roots of the teeth back.
Really?
Yeah.
Is that a simple procedure?
It is a simple procedure.
Really?
Yeah. It's a procedure that I actually teach to dentists around the country.
What don't you teach to dentists around the country?
I don't know.
Not very much.
Thank you. Well, I appreciate that. But I have partnered with a company that teaches minimally invasive implants, which still sounds kind of bad, right? But it's less pain, less recovery time. It's a very simple procedure. It takes, you know, a few minutes. It's very, very simple.
A few minutes.
It does, yeah.
So what is this like a dowel rod being shoved in your jaw and then you plant your
shoved
tooth on top?
Is a little.
Okay, and then you put the tooth on the end of it.
Hammered.
Yeah.
Okay. Hammered in.
Oh wow!
That's not too far off.
But there's no hammering. But it's very gentle. I mean, you're numb the whole time. People say they don't feel anything, and then
it looks
afterwards,
like the base of a screw.
It's titanium, so it's a little more advanced for a screw. But
that's basically what. But titanium, the body won't reject it. Is that right?
The body won't reject it. It's very biocompatible.
Okay.
Yeah, right.
So that will last you forever, or does that need to be replaced at some point?
It actually integrates with the bone, and it.
So the bone grows
generally stays there forever.
Really?
Yeah, the bone grows around it.
And so you're attaching what the base to that implant that you have,
and then you attach
that metal
the tooth,
piece, and then the tooth goes on the end of that.
Right.
So,
That's
in case anything ever happens to that tooth, so you can do some repairs on. Is that the idea?
Right, absolutely. And usually
I never knew they did like that.
I know, it's so cool, isn't it?
I had heard about it, but it just sounded very
It's becoming more and more common. It hasn't been all that common because it sounds like a terrible procedure, and in the past it's been very expensive, and the cost is like computers. You know, the more computers are around, the cost goes down and down, and so implants have come way down.
What does an implant cost?
Roughly an implant costs, I mean, you know, it still is, well, it depends. There's so many situations. So if you're replacing all of your teeth with implants, it's more than a single implant.
Right.
So we really recommend people just come in and, you know, we do complimentary consultations and have an evaluation. So we don't, you know, charge people just to kind of tell them what's possible and how it is. But it used to be that implants were, you know, just to put the implant in was between $2,500 and $3,000.
Oh, wow.
Yeah, and so it's come way, way, way down from there. So.
Now, what about insurance? Any insurance
Sometimes insurance does help, yes.
Okay.
Yep, sometimes insurance. You know, insurance never covers everything, but a lot of times it helps.
All right, let's take a look at what somebody looked like before and after. Oh, wow.
Big change.
Are you serious?
Serious, yep. And you can floss in between them. I mean, they look and feel like regular teeth.
What is the recovery time for something like that?
Nothing. I mean, people go right back to work afterwards.
Really?
Yeah.
Serious?
No way.
Yeah.
So this might be even something you consider as an alternative to doing a root canal then?
Absolutely.
Oh,
yes.
really?
Right.
Yeah, and that's one of the things. Yeah, that's
which
one
I can
of the
tell
things.
you is invasive and it takes a while. And
painful.
I've had a couple. So.
Right. I mean, now to be clear, if you're putting in a whole bunch of implants, it's going to be, you know, a little bit more. But honestly, most people just really don't feel a lot of pain afterwards.
Now, Steffany, on this one here, how many of the teeth on the right are the original ones as opposed to the left, or are they all new ones?
So one tooth is an implant. So the one tooth that's missing was replaced with an implant, and then everything else is veneered. So
Cleaned up.
Cleaned up is a good way to put it.
How?
Wow,
it just looks like a perfect match. Like, how does that?
Yeah, I mean that's just good dentistry.
By doing the veneers, you make everything the same.
Make everything the same.
Okay, so people want to make sure they're going to a great place. Have you guys gone through many educational,
many
you know,
Steffany teaches it. Did
well,
you just hear her
I
say
understand that, but you know,
Right,
Steffany
right.
might not. She has an incredible crew of ladies working for her, but it's like, how do you know you're going to the right place and getting the right procedure done?
And I think that people use their best judgment. You know, I mean, and that's why we have people come meet us, because I don't want anybody that isn't comfortable at our office having treatment there. I mean, that, you know, sometimes it's a great match, sometimes it's not. So, I mean, you know, we had a really big hard time with that, right, Jackie? We didn't.
Oh, I know.
Didn't connect.
Didn't get along very well.
We didn't get along
we were
very
having a party before too long,
Right.
so
But
like I said,
mean,
you guys
but
are
we
amazing.
want people to feel very comfortable in our office, and other dentists want that as well. So, I mean, but I think the really big thing is that the dentist has to have a comfort level with the procedure or the treatment. But my biggest concern is that if you go to an office that doesn't do dental implants, they're going to suggest, you know, other treatment. They're going to suggest something. So our office is, I think of our office as kind of like the Mayo Clinic or the Iowa Clinic or something, that we have a very comprehensive approach to things. So we're not going to just suggest the one thing that we do. We're going to suggest, okay, this is, you know, dental implants are the best, and then you could have a bridge if you have a tooth missing, and then you could have something removable like a partial if you have something missing. So I mean, there really are steps and stages.
I didn't know that there were options like that.
There
I
are
usually took
options like
whenever
that.
the dentist said, "Well, you need a bridge."
Right.
Automatically, that was the answer
That's
that
the
you
answer.
If you
needed.
don't get any options, then that concerns me a little bit.
I didn't realize that was an
Yep,
option.
Yep.
Because I think I do have one of those. I think I have a bridge.
And bridges are great, but they also they can compromise the two teeth on either side. So I mean, to some degree, more than an implant would.
Okay. So in case you're running across that situation, inquire about whether or not an implant is something that you would want to have done to you, and if not, inquire as to who else can do it.
Right.
Yeah,
Absolutely.
get a free consultation from the lady who actually teaches about it.
Well, and again, the thing that we talked about last week is that, you know, the dentists in Iowa are phenomenal. I mean, we're really, really
And
fortunate
everybody gets
here.
along, it seems like, too.
Everybody gets along, yeah.